which is called contour thread lift. It's a brand new procedure which has come from the US. That's where it was originated. And the man who's doing it here is a surgeon who's called Lalloo, and he is going to show us exactly what's involved here.
Hi, Pat.
You're very welcome to the Late Late Show. Now, you've already done a little bit of work this afternoon, but before we have a look at Valerie, thank you, Valerie, for agreeing to participate in this. We're going to have a look at Valerie this afternoon before anything at all was done. So let's have a look at this. Now, this is the beginning of the procedure. Explain what exactly is going on here.
Okay, well...
What do you actually do?
What I do, Pat, is I make a small incision, either in the temporal tuft, just at the hairline here, or behind the hair at the back. I pass a needle under local anaesthetic, so there's no general anaesthetic involved with this. It's an office procedure, so it can be done in the surgery. Pass the needle through, comes out the other side of the face. With that, the threads come to, and I snip the needle off and pull the thread.
All right. Let's have a look at this afternoon when you actually put the needles through Valerie's face.
Okay.
Now, the needle goes through, and then the filament is pulled through afterwards, is that right?
Absolutely. So the needle's pushed through, comes out the other side. It looks painful. It's not painful at all.
Valerie, did you have any pain?
No, just a wee bit of pressure, but no pain.
No pain. Now, we can see the filament being pulled out. How many filaments do you need for a full facelift?
For a full face part, typically about 8. 8 will do.
Four on each side?
Approximately,
will do it. Now, the idea is then that you pull these filaments through. What happens then?
Well, once we've done it, excuse me, once we've pulled the filaments through, I will then go about the process of contouring the face. And I will ask the patient how high they would like to go. So in Valerie's case, we lifted the right side of her brow approximately a centimetre, pulled her jowls back to give her a nice tight chin line, and she was happy with that. We could go further, but we didn't.
So looking at Valerie's face now, you have removed the threads, the filaments, from one side, if we can have a look straight on the face, right? And you can see the other filaments are still in place.
Yes, yes. There is a little bit of a lift from this side, but basically this side has been lifted up, and this brow here is lower than the brow on the right. So when I contour the threads for you, you'll see that the excuse me, the filaments will pull the skin back into place.
Do you want to do the procedure now?
Sure, yeah. And if you could be so kind. Just
how long does this take, by the way? Just a matter of minutes?
It takes me to do this procedure probably for a full face an hour to an hour and a half in total. This is a relatively new procedure, as you've mentioned. It's been in the States for a few years, and in Ireland we're sort of catching on to it now. I myself specialise in non-surgical or cosmetic medical treatments.
So you're pulling these threads now?
So what I'm going to do is I'm going to pull the threads, and you'll see that the thread will come out a little bit further, and if I let go of it at this stage, if you let go there, Alan, you'll see that Valerie's brow's really quite raised up on that side.
Right, because each thread has little bumps along it, and as you pull them out, they can't go back in.
Absolutely. Each thread has a few hundred little cogs on it, and each cog grasps the skin and holds it in place. So what I'm going to do now is I'm just going to contour this one back a little bit further. Valerie and I have decided already how much of a lift she wants. So I'm just going to, that's lifted up now, and I'm going to just put it into position. And there, nice and even. And you can see the lift is there. We pull the thread and snip.
There's a little bit of blood involved, not much. How much blood would there be from the needle going in and all of that?
About an egg cup full in total. You know, that's about it. No, if you just put that there on for a sec, yeah. No worse than if you were having a small minor surgery to have a procedure
you've got two
done.
more.
So we've just got these ones. Now you can see that's a pretty instant pull on the face. That just lifts the jaw right back. And so in my practice, I would normally do an awful lot of other cosmetic procedures, a lot of Botox, a lot of fillers. And as Maura was saying, it's an ever-growing industry. It's an evolution of society, really. And there are people who have it done for various reasons, aesthetic, and then there are other people who have other treatments because they've had, say, cancer in their life and they want to have their face filled out, or small things like to you and I, such as acne, which can destroy somebody else's life, but can be treated.
And that's it.
And
You've got two more.
And we just got two on the neck. This was Valerie's main concern, was her neck. So it's got a bit of a thread there. So this basically will keep Valerie going for the next between 3 and 5 years. That's fine.
And can you do it again then? In 5
Absolutely,
years' time?
you can. I'm not touching any of the muscles underneath, or not going near any of the nerves, or hopefully none of the big blood vessels. And one.
What do you mean, hopefully?
Well, this should be done by somebody who's trained in the procedure, obviously, Pat.
Because this is done by a surgeon. This is
absolutely, yeah. But as far as surgery goes, that's fine now. It's a straightforward enough procedure. And so there we have the face contoured now. And that's
now, there is a little bruising. How long will it take for that bruising to go?
About a week. No worse than if Valerie bumped her head.
All right. Now, Valerie, have a look at yourself there in that camera. Go on, have a look. Now, if you can try and overlook the slight bruising that you've got and some of the blood, what do you think?
Oh, I'm delighted, but I just feel like Mike Tyson at the moment, but it'll be all right.
Yeah. And why did you want to do this?
I suppose we look in the mirror, you think you're young till you look in the mirror and everything's sort of going south, so you feel like you want to...
So you feel like you wanted to give yourself a little cheering up?
Yeah.
A lift in every sense of...
I didn't want to look like Joan Rivers or anything like that,
All right, okay. Well, Valerie, thank you. And Mukesh, Lalloo, thank you very
You're
much.
Welcome. You're welcome.
The clinic is called Cosmedics, isn't that
That's
right?
correct,
Cosmedics, all right.
Cosmetics.ie.
Thank you very much. And Valerie, particularly, thank you. How much does it cost, by the way?
Treatment started about €2,000.
About €2,000. Is that a half face or a full face? Or
I'll do half your face if you want, Pat. About 2,000 for the jawline.
2,000 for the jawline, and moving on up there, depending on how much you want done.